Good afternoon. Welcome to ADHD, Eating Disorders and Body Image, What Parents Need to Know. I'm Valerie Barton. I'm the Executive Director of the Youth Mental Health Project. We are dedicated to helping families and communities to better understand and care for the mental health of youth. We focus on parents and caregivers because it is the case that young people rely on their parents and adult caregivers for guidance as they grow up in a lot of different areas, including mental health. And so parents need the education to feel empowered, and they also need to feel supported in order to best care for their kids. If you want to know more, you can go to our website at ymhproject.org. I am absolutely thrilled today to be joined by Dr. Roberto Olivardia. He is a clinical psychologist and clinical associate at McLean Hospital and a lecturer in the Department of Psychiatry at Harvard Medical School. He maintains a private psychotherapy practice in Lexington, Massachusetts, where he specializes in the treatment of ADHD, body dysmorphic disorder, and obsessive-compulsive disorder. He also specializes in the treatment of eating disorders in boys and men. He is the co-author of the Adonis Complex, which is a book which details the various manifestations of body image problems in males. He's on the scientific advisory board for Attitude magazine, which is a publication serving the needs of individuals with ADHD and learning disabilities. He also sits on the professional advisory boards for children and adults with ADHD, CHAD, the Attention Deficit Disorder Association, and is a featured expert for Understood. He presents at a lot of conferences, podcasts, and webinars, including ours today, all around the country. He is also a member of the International OCD Foundation, International Dyslexia Association, Multi-Service Eating Disorders Association, and the American Association of Suicidology. So he is a very, very busy person, and we are excited that he is joining us today. So we are going to, if you have questions during the event, feel free to put them in the chat, and we will save some time at the end for questions. Welcome, Dr. Olivardia.
It's great to be here. Thank you, Valerie. And very glad to be doing this talk. I'm going to share my slides here. Let's see. There we go. Okay. So I'm very excited to be giving this talk. And one of the things that I always feel also should be in my bio is I come from this, particularly with ADHD, not only from a professional point of view, but as a parent. I have two children, both with ADHD and dyslexia, and I have ADHD. So I come to this issue from a number of different dimensions and perspectives, so can certainly empathize with parents out there who are trying to sort of navigate this space with their kids. So why are we talking about ADHD and eating disorders? So just to let you all know that I've been researching, treating, writing specifically in the area of boys and men with eating disorders for the last 25 years. And it's something, a population that I still feel is often under-recognized, and have been working in that space. And through that work, would also, because I also specialize in working with people with ADHD, would see a lot of patients who have both ADHD and whether it's a clinical eating disorder or more kind of dysregulated impulsive eating. And that really started me on this sort of more academic journey of understanding this comorbidity or this relationship. Now, what we know about ADHD is it rarely travels alone, that most people with ADHD will have a comorbid condition, whether it's anxiety or depression, issues with addictive type of behaviors. We know ADHD affects every life domain. And in this case, we're talking about one of the most fundamental life domains, which is eating, which is something we have to do every day. And in this context, one of the things that I always want to emphasize is how important it is to understand the ADHD and how treating ADHD is essential in treating any other comorbid disorder that might come along with the ADHD. So briefly, and for those of you who may already know this, when we're talking about ADHD, we're really talking about four major components. So one is attention dysregulation. So the term attention deficit is a bit of a misnomer. It's not that people with ADHD lack attention, it's that we have a hard time regulating it. So if it's something that we're interested in, all lights are on, attention is in, we're actually in hyper focus mode. We could absorb even more details than probably the average neurotypical individual. The problem is if we're not so interested, if the stimulation isn't, or enough stimulation isn't there, it's like nothing is happening. So it's like a good old fashioned light switch, as opposed to a more regulated attention could be a dimmer switch for a light. In addition to that, you have symptoms associated with impulsivity, and impulsivity doesn't always have to be the rambunctious boy that's bouncing off the walls in the classroom. Impulsivity could come in the form of verbal impulsivity, blurting things out, talking out of turn. It could be sort of this like fidgeting or restlessness. It could certainly come in the form of other behaviors in which individuals really have a hard time managing and regulating themselves. And of course, we're going to be talking about one such issue, which is when it comes to food and eating. Hyperactivity, which again, a lot of times when people hear hyperactivity, they think of the rambunctious boy. One of the myths of ADHD is that boys outnumber girls, and that's actually not true. That we're just as in the eating disorder space, we know that there are a lot more boys than men who have eating disorders. In the ADHD space, there are a lot more girls and women who have ADHD than are diagnosed. And part of that is not all girls and not all people with ADHD present in this sort of classic hyperactive way. So that hyperactivity doesn't always have to present itself for someone to be diagnosed with ADHD. But also hyperactivity is not just being conceptualized as a physical hyperactivity, but it could also be a mental hyperactivity. So for individuals who have enough inhibition to stay in their seat, let's say, but their minds could be really racing, which can look like and mimic anxiety, but could actually be a form of that hyperactivity. The fourth basic category are the executive functions. So people with ADHD have trouble with executive functions, which are all the cognitive processes that we need to execute to get tasks done. So and there are all these different domains. We have attention, our ability to regulate attention, to shift our attention from one thing to another, to transition our attention, our action, to be able to monitor what we're doing in the present moment, to learn from errors and from mistakes. And again, this is where attention, to be attentive to those errors and mistakes in order to learn from them. Monitoring our activities and being aware of, and we'll be talking again today about eating, of managing the impulse of wanting to do something, but also recognizing and having that cognitive executive function of recognizing consequences, how we process information, remembering our working memory, planning, organizing, time management, our ability to regulate our emotions. People with ADHD are one of the reasons that we're at higher risk for depression, for anxiety, is that there is a vulnerability to having a difficulty regulating emotion, which is now conceptualized as an executive function. And effort. Having ADHD is, it can look, and many people with ADHD definitely have heard that they're not trying to their potential, might be called lazy. And part of ADHD is having that oomph, like that kind of energy to put in the effort. And a lot of times, one of the sayings we have in the ADHD community is ADHD is not always about knowing what to do, it's about doing what you know. And that's where the executive function piece comes in. So that's sort of a quick overview just on ADHD, just so we all have a common understanding of what it is that we're talking about. And I'll talk a little bit more about the ADHD brain when we talk about it in the context of eating. So now when we look into the space of ADHD and obesity and eating disorders, let me just briefly define what I'm talking about with an eating disorder. So we have these DSM, which is the Diagnostic Statistical Manual, that lists different criteria for different psychiatric disorders. For eating disorders, we have binge eating disorder, which is typically somebody eating a tremendous amount of food, which is more than what a person would typically eat within a 2-hour period of time, to the point of being uncomfortably full, feeling out of control, often feeling really bad afterwards, physically bad and emotionally bad. Bulimia nervosa would be those binge eating episodes, but that are coupled with purging episodes to, in a sense, try to undo or neutralize the binge. And purging could be in the form of self-induced vomiting, of laxative use, of fasting, of excessive exercise is a way to try to undo the caloric intake that somebody did. And typically with bulimia, you would, at least in the DSM, there's often a body image component attached to it, although you don't always have to have a body image component, as I'll talk about in the context with ADHD. Other eating disorders, such as avoidant and restrictive food intake disorder, which is also known as ARFID, which basically is a diagnosis that is more connected to individuals who can look like they have anorexia nervosa, which is the last one on this list. And anorexia is basically where someone is restricting calories, so they're kind of starving themselves. But anorexia nervosa, in its classic sense, has this sort of sense of a disturbed body image where people see themselves often as looking larger than they actually are. With ARFID, that body image component doesn't have to be present. So you might see ARFID, let's say, in individuals with ADHD and individuals on the autism spectrum who might have problems taking in enough calories, but not because they have concerns about their body image or their weight. It could be for a number of other reasons. And then again, there are lots of people who might not fit the specific criteria of purging this many times a week or binging this many times a week to warrant a diagnosis of bulimia or binge eating disorder, but where their eating nonetheless is still disordered and unhealthy and could be quite impairing and unhealthy for them. So there's this diagnosis called other specified feeding or eating disorders, or OSFED. Used to be called eating disorder not otherwise specified. And just as a note, again, because I do a lot of work in this space, that contrary to popular belief, that studies show that 1 in 4 people who have an eating disorder are male, that it's much more common than people think. However, 1 in 20 eating disorder patients are male. So there's a lot of men who never present for treatment of an eating disorder. Doing the work that I do, I am often the only person that some of my male patients have disclosed that they even have an eating disorder to, even them not disclosing it to some of their close family members. At least 10 to 15 million men are affected by eating disorders. And there are a lot of eating disorder behaviors that are seen as subclinical, is sort of the term, that studies show that are just as common actually with men versus as compared to women. So although they might not fit those DSM criteria perfectly, but those eating disorder behaviors are just as prevalent. And just because it's subclinical, and I put that word in quotes, does not mean it is less dangerous or somehow more healthy. It could be just as impairing on somebody's physical and mental health. And in fact, LaGrange, who's a researcher, found a sample of men with eating disorders, and 80% of them fell into that otherwise specified, feeding and eating disorder behavior, which means a lot of that can get missed. Now, when we talk about ADHD, one of the things that parents, a lot of you out there probably already know this, just seeing your kids with ADHD, is this sort of impulsivity around food in general. And, I can share with you that I found it very validating when, my mom once shared with me that I'm the youngest of 3 kids, that with my older 2 siblings, she would, even as toddlers, you'd be in a high chair, you put out the food on the tray there, and, and a kid will take a piece, eat it, take another piece and eat it, take another piece, and eat it. And she said, I mean, this goes, we're talking is, very young. She put the food out there for me and I would scoop it all up and shove it in my mouth. I mean, to the point that I was almost choking. Like, it was almost like hardwired, like, to consume it, like, and let's take it all in. And as a kid, my brother, I have an older brother, would call me the musher at Thanksgiving, because unlike him, who would sometimes like separate his food, I would take the turkey, the gravy, the mashed potatoes, the corn, the stuffing, and I would mush it in a big old mush. And because for me, I wanted every bite, I wanted to taste everything in every bite. And I'll explain why that's very common for people with ADHD. But when I heard that, I mean, I found it funny, and I thought, that makes sense. And it's validating because it shows that there's something sort of in my wiring that that craves that kind of consumption. Now, Hartman did a great study in 2012 where he did a lab experiment where he had kids between the ages of 10 to 14, and he measured them on indices of mood, impulsivity, loss of control in eating surveys, looked at their mood before eating, after eating, what foods they liked and didn't like, and put them in this lab that had access to food. And he basically, the kids were controlled on a lot of variables with the exception of one group of kids had ADHD, one did not. And the results showed that the kids with ADHD ate more, that they consumed more. And what was interesting, it was not influenced by their mood state. So it's not that the kids with ADHD were somehow more depressed or more anxious, that they just tended to eat more. It was not related to their level of hunger. And it wasn't even related to how much they liked the food. It really came down to the food was just there. And the fact that it was just there was enough for them to eat it. So I jokingly refer to it as the seafood diet. Like we see it, we eat it. And that is something that's sort of a very common experience. And I remember when I was 10 years old at Chuck E. Cheese, of all places, when Chuck E. Cheese was cool to be at, and my friend had a birthday party, and I love pizza, and we ate a lot of pizza. We were going on the rides and playing the video games, and my friend's mom said, "Oh, guys, finish up this pizza because I don't want to waste it." And we had eaten like a lot, and I remember this kid at the party saying, "Oh, no thanks, like I'm full." And I said to him, "Oh, you didn't like the pizza?" And he said, "No, I like the pizza. I'm full." And I'm thinking, but, oh, you didn't like this pizza? Because of course, I was of course going to eat more pizza. I like pizza. The fact that I would even tune into myself to be like, oh, wait a minute, I probably ate like 5 or 6 slices. It wouldn't have even occurred to me. And I asked him again, I'm like, oh, were you just not into this pizza? And he looked at me like I had 3 heads. And he's like, it's almost like, I don't understand what you don't understand about this. I'm full, like I'm not going to eat anymore. And for me, it was a concept of, I like pizza, it's in front of me, of course I'm going to eat it. Like the idea that I would have that mindfulness of satiety and tune in was something I had to learn throughout my life. And so again, this study very much resonates, with me. Other studies find that people with ADHD had more disruptive eating habits, tended to eat a less nutritious diet, and definitely took in more sugar and had a significantly higher tolerance for sugar, especially with beverages. And that story, I always think about when Dunkin' Donuts came out with their strawberry culotta in the mid 90s. And it's basically, I don't know, 1,000 milligrams of sugar and crushed ice. And I drank it and I thought, oh my gosh, this is so, so good. And bought another one. I came home and I remember some of my family were at my house and I said, oh my gosh, you guys have to try this. It's so good. And many of them responded like, oh my God, this is so disgusting. Like there's so much sugar in this. And I'm like, yeah, like I know that's what's so good about it. But again, this is how wiring could be very different. So it's no wonder in hearing just that you would see the significantly higher prevalence of obesity in people with ADHD. And people with ADHD do have a much higher risk of obesity and being overweight. And even way back, 20 years ago, there were studies looking at bariatric patients, people who presented for gastric bypass studies. In this study, it was 215 individuals, and found that about 1/3 of them had ADD. And more importantly, even at post-surgery, the ones that had ADHD were lost less weight and were less compliant post-surgery. So they found that, and in fact, when they looked at individuals whose body mass index was in the morbidly obese range, that there was a much higher prevalence of people with ADHD in that group. Similarly with kids, this was looked at in a small sample of 13 boys and girls in a clinic for obesity and these were kids with ADHD. They did not meet any other criteria for any other DSM disorder and found that almost 60% of them had ADHD. And interestingly, only 40% of them were diagnosed before the study. Now, Holtkamp had wondered, well, if kids with ADHD, if they're so hyperactive, wouldn't that protect them from obesity if they're burning calories and running around? Well, in a study looking at about 100 male patients with ADHD who were young, found actually the opposite, that those individuals who were had hyperactivity were more likely to be overweight, and especially if their body mass index was over the 90th percentile, they found that ADHD was even more common in that group. And similarly, Khalif found that ADHD symptoms at age 8 was associated with obesity at age 16, even after adjusting for gender and for baseline body mass index. So when they do longitudinal studies, that we see that risk factor really present itself. Now, similarly, when we're talking about clinical eating disorders like bulimia, nervosa, binge eating disorder, that we see, again, this higher risk of ADHD. Joe Biederman here at Mass General Hospital found in his studies that ADHD girls are 3.5 times more likely to have an eating disorder, bulimia and binge eating disorder, than girls without ADHD. At the University of Virginia in California, that bulimia was more common in ADHD adolescent girls than girls without ADHD. Dr. Craig Sermon found in a sample of women with ADHD that 11% of them had reported a history of bulimia versus only 1% of women without ADHD. And Seitz found that 1/5 of patients who were treated for bulimia had attention deficit disorder. Similarly, studies have found in samples of eating disorder patients that when assessed, because it's unfortunately not always assessed in eating disorder programs or populations, that about 1/3 of them met the screening cutoff for ADHD. And similarly, in another sample of almost 200 women with eating disorders, that ADHD symptoms were correlated with symptoms of bulimia nervosa, what was then called eating disorder, not otherwise specified, binge eating disorder. And very important and noteworthy is that the severity of the eating disorder was influenced by the severity of the ADHD. So the more severe those ADHD symptoms were, the more that impacted the severity of the eating disorder. I was part of a study of a very large sample of a longitudinal health study that found that having the more likely someone were to have ADHD symptoms, the higher the risk was for clinical eating disorder symptoms. And also, again, noteworthy is that in this sample, Svedlund did in 2018 in 443 female adults with eating disorders, that higher ADHD symptoms at baseline were more predictive for non-recovery. Now, what's important to note, though, is not to be defeated if somebody has ADHD and an eating disorder, that their prognosis is necessarily going to be worse. The issue is that often the ADHD does not get adequate treatment. So as long as somebody understands the importance of treating the ADHD, then we see a better prognosis. There are no current studies that focus on anorexia nervosa and ADHD. I have treated men with anorexia and ADHD, but far less common than binge eating and bulimia. So why is that? Why is it that how is having ADHD, how does that predispose someone to develop an eating disorder, disordered eating, obesity? Well, when we understand, again, the various notions of what ADHD are, it makes complete sense. So we start with the ADHD brain. An ADHD brain, well, all brains have neurotransmitters or neurochemicals in them that help regulate all different things, our mood, our sleep, our eating, our appetite. And there's one in particular called dopamine. And dopamine is implicated in reward. So when we feel rewarded, when we feel motivated, we're having adequate levels of dopamine. When we feel adequately stimulated, grounded in the present moment, we have adequate levels of dopamine. Well, the ADHD brain has a consistent dopamine deficit. So I liken it to that the ADHD at baseline is a bored, understimulated brain. So we are in what's called a reward deficiency syndrome all the time. So I personally think of ADHD as I am oriented to the world by what is going to stimulate me. And everything that's pleasurable is stimulating, but also there are lots of things that are stimulating that are not pleasurable. Danger is very stimulating, conflict, drama, anxiety. And that can explain also why my younger self did a lot of crazy, dangerous things that now my adult self will be like, what was I thinking? But now I'm realizing it was the stimulation. I mean, the saying I would have as a kid is, oh, this will be a good story one day. Would be my justification for the many shenanigans I got myself into. And there's another so that's dopamine. There's another neurotransmitter called GABA. And when we have adequate levels of GABA, we are appropriately inhibited, which means that after having 3 pieces of cake, if we have appropriate levels of GABA, maybe after the first piece of cake, we said, you know what, I'm good with 1 piece of cake. Having 2, having 3 might be too much, and I might feel sick afterwards. So I'm going to stop. Well, it turns out the ADHD brain also has a GABA deficiency. So it is now a bored, understimulated, uninhibited brain, that it takes a little bit longer for there are delays sort of in being able to kind of, and sometimes it's not a delay, it just is until we hit the consequence that we're like, oh, I shouldn't have, done that. So the ADHD brain in studies of emotional dysregulation and emotional processing finds that the ADHD brain has a delay in being able to soothe itself very quickly. So now when we understand all of that in relation to food, because let's face it, I mean, when people are binge eating, when people are typically overeating, they're not overeating and binging on kale and cabbage. It's typically high sugar, simple carbs, type of food. Sometimes it could be high protein foods, as well. But the sensory aspect of all that is providing such reward. Sugar in particular is definitely like a dopamine burst, in the brain. So this controversy of is sugar addictive? Is it not? I'm not a nutritionist, but I can tell you that I think it varies on the person. Like it's all on I do definitely believe that different people, and we know this with addiction, their brain will respond in a reward to different things, in that way. And sugar doesn't have that rewarding element for everybody, but for a lot of people with ADHD, it definitely does. So GABA, if you're not appropriately inhibited, it's harder then to say, no, we have to eat every single day. So for someone with ADHD, if food is this thing that's rewarding, now here's something that you have to regulate constantly. It's not even, it's really, there's eating and sleep, like those are the things, and I could do a whole other talk about sleep and sleep disorders with ADHD, but can be a very difficult thing for people to sort of know how to manage. In addition, for people who have engaged in binge eating and purging behaviors, a lot of times patients of mine will say that they will gravitate to food after they do another sort of dopamine related activity that's kind of like on its way out. So it could be after they have sex, it could be after they, for younger people I work with, it's like, yeah, after my parents kicked me off of video games, like I find myself like almost looking for the next thing, and food can become that next thing to keep those dopamine levels up. Now, genetic research is finding that dopamine receptors do overlap between ADHD and things like obesity and binge eating, particularly that DRD4 gene is one that's being heavily researched in terms of how that particular gene is mapped to ADHD, to binge eating, to sensation seeking and thrill seeking behaviors, which all make sense. But even many years ago, Alan Zemetkin was doing studies and brain scans looking at how the ADHD brain was slower to absorb glucose than non-ADHD brains, and particularly in the frontal lobe. So it took a little longer, in a sense, before somebody felt satiated from eating certain foods. We also know that serotonin, which is a neurotransmitter that's implicated in feeling calm, can boost feelings of well-being, and that people with ADHD are pleasure seekers, that they want to feel good. Now, we also know, as I was mentioning with my Chuck E. Cheese example, people with ADHD, as well as people with eating disorders, often have what's called a low interoceptive awareness. And what that means is a lack of mindfulness of what's happening inside the body. So that could be hunger cues, satiety cues, sleep cues, going to the bathroom cues, like all of those things require someone to be in the moment and be able to tune in, where ADHD I think of as like extra, we're tuning out, like we're looking outward for like our stimulation, that sometimes it's almost like we are neglecting sort of those bodily cues. And in order to eat healthily, you have to begin to develop those kinds of cues. We know that executive functioning deficits can make it very difficult for people to eat healthily and to eat in a regulated fashion. A lot of times, even with young people I work with, they'll say, oh yeah, I skipped lunch because I just was, working through this paper. I was talking to my friends in the hall, and I forgot that, I needed to get into the lunch line, and then I didn't get lunch, and then they come home and they're ravenously hungry. And certainly I see that with adults all the time who might skip meals and then they're really hungry, or they haven't planned, their meals really well. And so they end up just relying on sort of less healthy food to fill them up. Decisions around food can be very overwhelming, that can lead a lot of people to just take whatever's easy and accessible to them. I used to use this word procrastinating when I was in college, that if I had a paper I had to write that I was just putting off, as people with ADHD are high procrastinators. Food was an easy thing to do, to be like, and I actually would use that term. I'm like, oh, who wants to procrastinate, with me? And we go to the sub shop and nearby my the college I went to, and that would be my version of procrastination. I wasn't a gamer. Video games would be my thing, but food and lots of other things could be that thing. And also, let's face it, I mean, there's so much information about food and diet and what's good to eat and not good to eat. And again, that could be very overwhelming. Food can also be a means of gaining executive fuel. A lot of times where it is hard for people with ADHD to just get going and to just initiate, sometimes they eat as a way, as in hopes that that will like boost their, their motor. And a lot of times with food, people can get very all or nothing about it. Then we have the behavioral factors. Good old impulsivity, as I mentioned, that seafood diet. A lot of times people will say to me, and this is even young people I work with, they're like, I know I shouldn't be eating 20 Oreo cookies, but I don't know. They're like, Dr. O, I ate 2, and the next thing I knew, like the whole sleeve was like empty. And I believe that, because that is part of what ADHD is. And I'm also convinced that there's some substance in the cream of Oreo cookies, because they are incredibly addictive. I was talking to someone the other day, and we were talking about how they have these, like, not only the double stuff, but they have this thing called most stuff. I mean, it's literally like this much cream in the Oreo. And there are 2 camps. There's either the people that are disgusted by that, or there's people like me who salivate when I hear about that, because I'm like, oh my gosh, that must taste so good. People with ADHD are poor self-regulators. They vastly underestimate the amount of calories that they ate, because in order to truly estimate the amount of calories and food that you're eating, you have to be mindful. You have to be in the moment. And that's hard. That takes effort, especially for young people to do. Poor sleep habits are associated with dysregulation of metabolism. And that's sleep deprivation is actually one of the contributing factors to obesity in this country, that when we are sleep deprived, our bodies, it messes with our body's metabolic cycle to the degree that our metabolism decreases while our craving for fats and sugars increases. And evolutionary biologists will say that part of the reason probably for that is that if we're not sleeping, our body assumes that some higher order need is threatened. And what is more higher order than either drinking water or eating food? So it thinks that, oh, well, maybe this person is in a famine, and that's why they're not sleeping, so that they can find food in this famine. And of course, for people in industrialized nations, that they're not in this famine state. Skipping meals, which can sometimes be due to just being hyper focused on whether it's work or something pleasurable, can later lead to an overconsumption of fats and carbs and sugars. And again, that hyper focus where people can work for 12, 14 hours or do something, but then suddenly they're hit with that wall of hunger. People with ADHD are also more likely to eat while doing other things, which leads to a poor regulation of food intake. I've had to tell my adult patients that they should not be eating while driving. And having meals while they're driving, but watching TV. Kids I work with, where we've had to have them, realize, if you're going to have, let's say, some chips, put them in a small bowl, because if you go with the whole bag and sit on the couch watching a movie, that whole bag is going to be, consumed. And then for people who do restrict, sometimes restriction can be an overcompensation for impulsivity. So people who get in this really terrible binge restriction cycle of, they're binge eat and then they feel so bad about it. They're like, oh, okay, I should just not eat. And then of course the restriction leads to then more binge eating, but it can be very all or nothing. We know that a stressful day for a lot of people, food and that pint of Ben and Jerry's is sort of normalized in our culture. And certainly we see that with ADHD, anger, sadness, stress, that food becomes a way of soothing those emotions. But honestly, the thing I hear most from my ADHD patients is boredom. And this was a quote, one of my young adult patients, that it's either a cigarette, my nails, or food. But I need something. So whether it's a sort of oral stimulation, sensory stimulation, but there's craving again, stimulation. Sometimes it could be coping with depression or anxiety. And sometimes it doesn't have to even be a trigger. Sometimes food, like happiness, can be a trigger. Like I tell people, like I know when I'm stressed, like eating is not something I do when I am stressed out. Like when I am in the height of stress, my appetite shuts down. Like I'm in like go mode, let's solve this issue mode. It's when everything calms down and things are good that it's like, okay, let's celebrate. So sometimes food is just a reward. Even it doesn't even have to be in the context of something distressing, or negative. And sometimes eating and binge eating could be a relief from just racing thoughts. And people with ADHD often will say that sometimes their thoughts are just going so fast that they just don't feel grounded. And when you are full, you are basically kind of grounding yourself because your body, when it's digesting all that food, is slowing down. For a lot of people with ADHD, because we're very sensory individuals, that food can also be very soothing. And then the avoidance of other foods can also be because it's very offensive on a sensory level. So sometimes you'll see kids with ADHD who can be very picky eaters. And the reason for that is that it's sort of how it's interacting with their sensory systems. People with ADHD are very outcome driven, instant gratifiers. So sometimes the time it takes to maybe prepare a meal, or, if I grew up in a household where we had to eat a bowl of salad before having our meal. And now I'm so thankful for that. But at the time, I would consume that salad as quickly as I can to get to like the real meal, I would call it, very impatient and impulsive. And sometimes it's not just eating, it could be just thinking about eating, thinking about food could be in and of itself a grounding mechanism. And I joke, like I dream about food in that way. And it's great. And I love that I love food. And at the same time, as with anything else with ADHD, anything that someone with ADHD likes, we run the risk of liking too much. And so we have to sort of regulate that. For people who have bulimia, who purge, particularly in the form of self-induced vomiting, also particularly with ADHD individuals, we'll talk about how vomiting provides almost like a stimulation effect, a very euphoric and very addictive level of stimulation, and that they're basically are using as a stimulant in some ways. So I've worked with college students who will say that they binge so that they can purge, and they purge so that they can focus better, that the sort of euphoric feeling around purging. Individuals with ADHD often struggle with self-esteem issues due to executive functioning issues, negative messaging. Sometimes it can affect their social lives, and negative body image can sometimes be this manifestation of not feeling good enough. And so where body image is concerned, and again, not all eating issues, obesity, eating disorders have to have this component of body image. I mean, sometimes the negative body image can be as a result of being, let's say, overweight, but it doesn't have to be a cause of the eating issue. But a lot of times I've seen people with ADHD that do have these body image issues where it's almost this sense like of overcompensating, like for not feeling good enough. If I look perfect on the outside, then it makes up for all these things I feel I lack on the inside. I can eat because I've been good today, that the focus on weight becomes very concrete in their self-esteem. Eating disorders are often about control, which many people with ADHD might feel that they lack. And And even, it's so important for people to understand, especially for a young person who, unless they have a context or a frame around it, which is why it's so important for anyone diagnosed with ADHD to have a proper frame of understanding what it is and how their brain, works, is you have this experience of putting in, I don't know, 3 times the amount of work than your peer might be, and you're getting out of it maybe a third of what your peer is getting out of it. And it's very frustrating. It can be a very, very frustrating experience. So I've heard these quotes from patients: if I control my weight, I control my life. Controlling my body and my weight is a thing I can succeed at. If I look perfectly on the inside, people will find me appealing and not see what I lack on the inside. So now that we sort of talked about ADHD and eating disorders, just a bit about treatment before we have time for questions and answers. So first, it's important to know only 1 in 10 people with an eating disorder receives treatment. Only 10% of people, I'm not talking about just 10% of men with eating disorders, 10% of all people with eating disorders receive treatment. It's still a vastly undertreated disorder in our culture. But when people do seek treatment, it is so imperative, and this is the mission of anytime I give talks about ADHD and a comorbid disorder, of addressing the ADHD and the eating disorder together, understanding how the ADHD impacts the eating issue and how it is impacted by the eating issue, because they can go back and forth. Poor nutrition also exacerbates all ADHD symptoms. Our ability to focus and regulate our attention are going to be even worse if we're not getting adequate levels of protein and vitamins and minerals. And a lot of times, even like with sugar, I once had a nutritionist once say, I remember at a conference, that, certainly the overconsumption of sugar is not good for us, but a lot of times it's not what we're eating that can become the problem, it's what we're not eating that could be almost more important. So when we overconsume on sugar, it means we're probably not eating then enough fruits, vegetables, and protein. Having untreated ADHD, which I should put that word untreated, ADHD undermines the treatment of ADHD as well as ADHD and an eating disorder. So when we look at these issues, it really is a multidimensional kind of treatment that's going to draw from many different sort of bodies of treatment. Main one being cognitive behavioral therapy, which looks at sort of our negative thought patterns and how we are thinking about ourselves, about our bodies, about our eating. And there is this term called cognitive distortions. If you look up on Google, there'll be a list of them. One of them is all or nothing thinking. Like if I'm going to have this dietary rule, and if I break it, then I might as well just go hog wild and break it all. It's like, no, like we don't have to think of it. It's not like either I'm perfect or I'm a failure. That way of thinking sets us up, for failure. So that's what cognitive therapy is. And the behavioral therapy is really beginning to be mindful to understanding what are the triggers to this. How do we recognize those times that we overeat? And for a lot of people with ADHD, it's just understanding, like I remember the first time I heard, don't go to the supermarket hungry. And I thought, oh my gosh, that's like profound. Like that makes total sense, because sure enough, if you go to the supermarket hungry, and certainly someone with ADHD, what are you going to come home with? You're going to come home with foods that are like all that dopamine, rich, kind of food. If you eat a good meal and you're, satiated, and you go to the supermarket and you have a list, you're less likely to buy those foods that later are not going to be the most healthy for you. Those are the kinds of things in behavioral therapy that you would work on. Dialectical behavior therapy is basically these modules of skills that originally was modeled for people with borderline personality disorder, but has now been empirically validated for depression, anxiety, for lots of different things. But I draw on with my patients skills on mindfulness, on emotional regulation, distress tolerance, and interpersonal effectiveness. All, frankly, skills that I think everybody can benefit from. Acceptance and commitment therapy is a newer sort of therapy which looks at values that people have. So with my patients who have eating disorders, when I say to them, okay, what is the value to you of, let's say, having a certain kind of body that you're idealizing, if they have a negative body image, because it's never really just about the number on the scale. They'll say, well, I want to be liked better. So that value is a good value. Like we all want to be liked and connect with people. Part of the therapy though is disentangling that the body is not the thing that's going to really fulfill that value, that there are a lot of other things and healthy things that fulfill that value. Oftentimes with eating disorders, they can include family therapy, certainly talk therapy, and where the ADHD is concerned, executive functioning coaching can be really important in terms of, again, working on the ADHD and how to regulate, how to tune in and be mindful. Mindfulness skills. I have a good friend of mine and colleague, his name is Dr. Mark Burton. And if you look him up, he's written some fantastic books on mindfulness for kids, and particularly kids with ADHD. And that's a skill that, you know, it can sound very like new agey for people, and that term is, but it really is these skills of how do we kind of be in the moment, because it's only when we're in the moment that we truly almost have the kind of the best lay of the land and the best platform for which to make decisions, is when we can be in the present moment. Self-compassion is so huge, and especially for the young people I work with who sometimes get really down on themselves for, oh, I'm so stupid, I made this careless error, whether it's a result of their ADHD or, oh my gosh, why did I eat so much of this? And, you know, all of that is to say, look, you know, there is this wiring here, but it doesn't just, it's not like, oh, it's destiny that you're going to be, you know, inundated with these issues. But yes, it does mean that you have to kind of be aware of it, and you have to work at it, maybe in a different way than somebody else does. But somebody else is going to have something else that they need to work on that maybe isn't going to be something that you have to work on. Things like assertiveness training, working with a nutritionist can be really helpful. And as I mentioned before, executive functioning training. And also just a note too of medications that in the eating disorder community, stimulant medication was actually seen as almost contraindicated because it can have appetite suppressant qualities to them. But where ADHD is in the mix, studies actually show that for stimulant medication can be very helpful. And in fact, the first FDA-approved medication for binge eating disorder is Vyvanse, which is a ADHD stimulant medication. Prozac is the only approved medication for bulimia. But for ADHD alone, we know that stimulants and non-stimulants can be very helpful. Not everybody with ADHD takes medication or has to take medication, but what we do find in the research is that it helps regulate the appetite, and more importantly, helps regulate somebody's ability to be mindful, which then can result in better food choices and less impulsivity in general. There's no medication specifically for anorexia. And then this part is, again, going back to the ADHD part that I think a central part of treatment, regardless of how old, and I work with very young children, I work with older adults with ADHD, is what is their view of philosophy of ADHD and learning? And we want to promote the idea that everybody learns differently, that the wiring of an ADHD brain is needed in our culture, just like the wiring of, I don't know, an accountant's brain, assuming that, most accountants that I know don't have ADHD. We need that kind of brain too. We need all this sort of neurodiversity. So we want to accept this ADHD brain. And, sometimes you hear these things like, oh, it's a gift, or it's a curse, and I think of it, and I promote the idea, it just is. It's like a coin. Like I think of my ADHD as, one side is responsible for a lot of great things and successes. Like I am doing exactly what I love to do because of my ADHD. Like I have to do what I love to do because I wouldn't be able to tolerate doing something that was not stimulating for me. So that meant like I was so astute to getting to something that I knew would basically be a steady flow of dopamine in the day. That's a plus. But ADHD has also been responsible for a lot of the not so great moments. And again, some sort of crazy scenarios and dark, impulsive, things. So it just, you kind of have to work with understanding it. But frankly, I tell especially kids, everybody's brain is like that. Like every brain has its strengths and weaknesses. I find it valuable, though, that we have this term ADHD, because now there's this body of research that we can look at that says, oh, that's why my brain is doing that. And this is a strategy to do that. And most importantly, that having ADHD, you have to accept that you need to do things that other people might not have to do. Doesn't mean you can't get to the end of the rainbow, but your path on getting there might be a little different. You have to accept those mistakes and failures and be your own researcher, your own detective, to figure out what's going to work for me. Because the goal for anyone with ADHD really is to understand how they learn and how they execute tasks in an optimal way, and to be non-judgmental. And we want to eliminate the false self-talk of, oh, how, it's not how can I, or it's not can I do this, it's how can I do this? What strategy, what will enable me? What supports do I need? And to take the shame away. We can acquaint even kids to the research, and there are ways to distill even what I've been talking about even to young people so that they have an understanding, but also understanding that just because these things are difficult doesn't mean you're not responsible and accountable for it. So when kids say, oh, I have ADHD, I can't do my homework. It's like, nope, you still got to do your homework. But I can understand why it might feel frustrating, or it might be harder for you to get started. And to have a sense of humor is really important about it, because I frankly think there's lots of funny things about having ADHD that sometimes for levity, you just kind of have to laugh at. And to find your group, every year the CHAD, which is an organization that I'm on the board for, a leading organization for ADHD, they have a conference every year. This year it's in Dallas. It'll be in person, hopefully. I highly recommend people who are really interested in learning about ADHD, but it's a fun conference because it's professionals, it's parents, it's educators, it's adults with ADHD, it's all kinds of people really on this mission to try to understand it. And webinars like this one educate people, and to know that there are positive features of this brain as well, but those positive features will only really be realized when you sort of work on the parts that can be more challenging. So I will stop there, and we have some time for some Q&A.
Thank you so much, Dr. Olivardia. That was great. Very informative. And as somebody who's married to someone with ADD and parents someone with ADD, this was incredibly helpful for me to hear. So we have a couple of minutes for questions. We got a couple about medication. So
yes.
One question, maybe you can kind of take these together. ADHD medications tend to affect appetite and
yes.
suppress appetite, and sort of what do you do if it's sort of the opposite of the binge eating and getting people to? And then someone else asked a question about bifestine. I don't know how to say that. Bifestine medication.
I'm not familiar with that medication.
Yeah, and is it it sort of, does it have to do with the not having the right dosage of these? Oh, biofentine.
That I'm not familiar with, but I can speak certainly generally. So I don't prescribe medications, but in the sense of typically with younger people who with stimulant medication, it can have an appetite suppressant effect. And the key is really to just load up on the calories basically in the morning and the evening. It's typically lunchtime that a lot of kids will report that they're just not hungry. However, once the medication wears off, they almost like will sometimes binge eat or overeat to sort of make up for those calories. And so because, we don't want it to be a feeling of like out of control, I usually recommend, if they eat a protein-rich breakfast, so it's not like, cereal, which really doesn't have much protein in it. If they can have eggs or yogurt or chicken from leftovers from the night before. I mean, again, ADHD is out of the box, so sometimes you gotta have out of the box strategies for it. And even if they could eat a little snack or just something at lunchtime, and then maybe when they come home from school, have something, and some kids might have like a protein bar and then have, a bigger dinner. So as long as they're getting their, calories in, but we want it to be in a way that feels sort of regulated for them. And then as far as I'm thinking maybe the second question might be about is the thing with just stimulants and ADHD treatment in general is there are a lot of different stimulants out there, and it really is trial and error as to what works for your child, because I've seen with identical twins who both have ADHD that one responds to one medication and the other did not, and they needed a different ADHD medication because it's so contextual on all of these different variables. Now, sometimes If somebody isn't getting an effect from it, it could be that the dose might need to be increased. Other times, if they have side effects from it, then they go off it and they try a different one. But it is the benefit of stimulants is that pretty much the day you take them how they will respond. You don't need them in your system for 2 weeks like an antidepressant, or 2 to 3 weeks like an antidepressant. You don't have to take them every day. Some people do. So it's something that is definitely more open to that kind of trial and error. And I tell people sometimes it can be like 4 or 5 different medication trials before someone finds the right stimulant, the right dosage, whether it's extended release or fast acting, the right time of day to take it so it's not disrupting appetite, so they're getting the maximal effect. So again, to me, it plays into that you kind of have to be your own researcher, and especially for young people working with their parents, with their doctor, to collect as much data as they can around it.
That's really helpful. So I think there's another question I want to get to, which is how is I'm probably going to say this one wrong too, orthorexia nervosa?
Oh, orthorexia, yes. So orthorexia is so it's not a diagnosable like DSM disorder, but it is a disorder that would probably actually fit more in that otherwise specified disorder. And orthorexia is characterized by individuals who might kind of present as having anorexia, but it really is almost more of like a manifestation of typically of an obsessive-compulsive disorder. So I treat patients who have orthorexia who will say that it's not so much about their body image, it's about they want to eat clean. And so a lot of times the clean is I want to eat stuff with no additives, no preservatives, that's organic, that can evolve into vegetarianism, evolve into veganism, and then it can get to a point where it gets very obsessive where they're eating almost nothing because everything has some. I mean, it got to a point. I remember working with a patient who had very severe orthorexia, where he wasn't even eating anything that was organic because the air itself is contaminated, and that fruit or vegetable is in the air, even if the farm was organic, but there's polluted air, and he wasn't eating anything. And it was not a anorexia from the perspective of I fear I'm too fat and I'm overweight. It was I need to eat clean. I want to eat healthy. And it just is like that value, which is again, that in ACT, that treatment, we would say the value of eating healthy is a great value. This has gone awry to the point that clearly it's impacting your health negatively. So your value is actually not being fulfilled here. But yes, that would be definitely another eating disorder that we see.
So is that more ADHD or is it more
I would
OCD or?
I would say more OCD. I don't really see that so much with ADHD. Yeah, I've seen it a couple times, but just like with anorexia, it's much less common than what typically with as far as eating issues. It's more binge eating, overeating, impulsive eating, bulimia, which are more the impulsive eating disorders, whereas anorexia, orthorexia tend to be what they call the more compulsive eating disorders, like people who are thinking so much that it's so heady for them. Whereas ADHD individuals are, I say we kind of operate from here, like from the soul, like of what's going to feel good. Yeah, that kind of, and to be too much in either space is not good, because if we're thinking too much, we don't tap into sort of our emotional selves and feeling what we feel and getting too caught up in like what's perfect. And if we're just in our heart and not thinking, then we just become these pleasure seekers that aren't thinking through the consequences of some of those decisions. So we need a little bit of both to kind of function. That's those mindfulness skills sort of teach us.
Yeah. So I know we're at time, and I want to be sensitive about that. We have a few other questions that have come in, and we will maybe, if you're open to that, we can maybe submit those to you and then share those back out with the attendees.
Absolutely. Yeah. And for me, my email is here also on this slide. So you can definitely send me those questions. And if people have other questions that we couldn't get to, please email me. I will definitely respond. It might take me, a couple days or so to respond, but I will respond to whatever questions you have, or if there are resources that you're looking for, I could do my best to try to direct you to good resources.
Thank you so much, Dr. Olivardia. We really appreciate you being here. I know I learned a lot. I think it was helpful for others as well. We had almost everyone stay till the end, which is really exciting. So we hope that you will come back. I know there's a lot of work I think that you do that would be of interest to our parents and families. So
Oh,
we
I'd
will
love to.
be back at some point to talk with us about other work that you do.
Absolutely. It'd be my pleasure. Thank you for
Thank you.
having me.
Have a great afternoon.
You too. Take care, everyone.